and this cycle therefore repeat itself. Another mosquito biting the person, the same cycle will keep on repeating itself. So there are some changes in different life cycle of different plasmodia. Vivax and falciparum may follow certain different life cycles, but more or less it is what we have described just now. Plasmodium, which when it enters the human body, it enters the red blood cells and it multiplies inside the red blood cells, and it multiplies, forms a great number inside the RBC, and it breaks the RBC or destroys the RBCs, and many sporozoids or plasmodia are released which infects other blood, that is other blood corpuscles, that is the RBCs, and therefore malaria starts destroying the blood or the RBCs of the body. It also clogs the liver. The liver tries to fight back, and in doing so the liver enlarges. At the same time, it also clogs the spleen. The spleen's job is to remove all the deformed or infected or the dead RBC, WBCs, platelets, and therefore the spleen tries to destroy the RBCs which are deformed or infected, and that also results in the spleen getting enlarged, and at the same time destruction of the RBCs and the spleen destroying the RBCs results in anemia or a lowered hemoglobin. So what are the clinical features of malaria? So after the bite of mosquito, if you get infected, it takes about 5 to 14 days for the parasite to multiply in the human body, and the person will start getting fever. It will be moderate to high degree of fever with lot of chills and rigors, a very unpleasant feeling, body aches and loss of appetite, lot of weakness and headache. In Plasmodium falciparum, the parasite can enter into the brain causing cerebral malaria, and in the brain it starts clogging the small arteries of the brain, causing a diffuse lack of oxygen in the entire brain, and that is called encephalopathy like picture. Confusion, drowsiness to unconsciousness can occur in cerebral malaria. Plasmodium vivax does not enter the brain and therefore do not cause cerebral malaria. Nowadays, we have often seen that the platelet count also reduces in malaria, not to that great extent as in dengue fever, but it does reduce, and this is because of direct suppression of the bone marrow, and also because the spleen is enlarged and therefore it destroys along with RBCs some amount of platelets also, and therefore in the blood count picture you find an anemia, that is a lowered hemoglobin. The WBC count may be normal or slightly high or low, but the platelet count may be normal or slightly low, and when we do a peripheral smear we can detect the malarial parasite. The fever can come daily, alternate day, or once in 3 days depending upon the type of malaria, but this pattern is not classically seen nowadays. Why? Because many mosquitoes may have bitten the same person, and therefore the blood stages of the parasite will be, different stages will be present at the same time, and therefore we generally see near continuous fever which is occurring. Secondly, most of the patients are inadequately treated, and therefore some stages are suppressed, and therefore fever pattern is not what it used to be classically seen maybe about 30 or 50 years ago. And so clinically to diagnose this fever is not very easy nowadays. All these illnesses, that is malaria, dengue, typhoid, viral fever, chikungunya, etc., present as practically the same picture of fever with chills and body aches, headache, backache, with only certain differences among them.